Hey guys, welcome to our simplex.com. I'm your registered nurse Oye. In this video, we'll be talking on introduction to pharmacology. When we say pharmacology was derived from two Greek words, which are pharmacon and logos. Pharmacon means drug, while logos means the study of or discourse on. So in essence, we can say that pharmacology is the scientific study of drugs and its interaction with the body of animals, that is, lower animals or humans. So, talking about drugs, we say that drug is any substance taken into the body or applied on the body for the purpose of diagnosis, prevention, or treatment or cure of diseases. Now, let's talk about this. Let's break it down. Now, when we say drugs are taken for the purpose of diagnosis, prevention, or treatment of disease. Now, let's take for instance, in the diagnostic procedure for renal disorder, we have one of the diagnostic procedures which are what? IV parallelogram, that is intravenous parallelogram. Now, this procedure simply involves the injection of a dye into the body, and it is observed with an external device to see how it moves within the body till it is eliminated. Now, that substance that is administered into the body is a drug, but it does not have a therapeutic effect on the body, but rather it acts for the purpose of diagnosis of the condition. Now, the next thing now is prevention. When you say drugs are taken for prevention, a major example of drugs taken for prevention of diseases is the vaccines that are given, such as the yellow fever vaccine, bacillus calmette and guarin, that's a vaccine for tuberculosis, and the rest of them which are administered. These drugs are given not for treatment but to prevent those diseases that are likely to occur in individuals. And lastly, for treatment purpose. Now, whenever someone breaks down with a disease condition, the person is given a particular drug which will help the person to get better. Now, those drugs are given in order to treat the person of that disease. So you get what I'm saying now. The next thing we'll talk about now is classification of drugs. Now, drugs can be classified basically into two groups which are referred to as agents, and the first group is what? The pharmacodynamic agents. Now, the pharmacodynamic agents, drug as a pharmacodynamic agent, it simply refers to the effects of the drug on the body. That's how the drug acts on the body. Now, any drug that is referred to as a pharmacodynamic agent, this drug acts on the body itself, that's on the body of the individual, such as those drugs that are administered for cardiovascular disorders, such as hypertension and the rest of them. While the next is chemotherapeutic agents. Now, a chemotherapeutic agent are those drugs that does not act necessarily on the body, but it acts to fight against infections and malignancy, that is abnormal growth of cells within the body. So it fights those causes. But these pharmacodynamic agents, what they do is they act on the various parts of the body, such as glands and receptors and parts of the brain, which will result in the release of hormones or neurotransmitters to perform a specific effect within the body part. So that's a pharmacodynamic agent. They stimulate various parts of the body to act. Pharmacodynamic agent, while the chemotherapeutic agent, they act directly on the infectious disease or the malignant cells. So you get that now. Now let's come back to pharmacology, which we're talking about. Pharmacology can be classification of pharmacology. Pharmacology can be classified into two basic groups or major groups. The first one is pharmacodynamics, and second is pharmacokinetics. Now, when we say pharmacodynamics, which is derived from a Greek word also, which known as, that is the pharmaco and the dynamics. Pharmaco, as said earlier, refers to drug, while dynamics refers to the power. So pharmacodynamics simply refers to the power of the drug in the body, that is the effect of the drug within the body. That's what the drug does to the body. So like what we have here now, we said what pharmacodynamics refers to what drug does in the body. That's the physical and the biochemical effects of drug on the body. Like I said earlier, during the classification of drugs, the pharmacodynamic agents, they act on the body, they act on glands, receptors, and so on and so forth. They act on receptors and glands to release various substances, and then they change the physical functioning of the body. So pharmacodynamics now, they have what physical and biochemical effects on the body. So the next is the pharmacokinetics. Pharmacokinetics simply is also derived from two Greek words. The first one, pharmacon, meaning drug, while kinetics refers to movement. So this pharmacokinetics now, it simply refers to the movement of drugs within the body of an organism. So when we say pharmacodynamics, from what we have here, we said well, pharmacokinetics refers to what the body does to drugs that have been administered. That's when you've taken the drug, what does the body do to the drug? What effect does the body have on the drug? The first one we said was, what effect does the drug have on the body? That's the changes it will cause. For example, a person who is febrile takes a drug and his temperature comes down, while the pharmacokinetics now refers to how does the body react to it. That's what does the body do to the drug to bring the temperature down. So in this pharmacokinetics, it will talk about, it refers to, it involves or it encompasses the absorption of the drug, the distribution of the drug throughout the body, the binding of the drug or storage of the drug at the receptor sites where they will act, while the transformation of the drug to substance that are able to have effect on the body, and lastly the excretion of drug within the body. Excretion of drug out of the body. In our next video, we will take a deeper look at the pharmacodynamics and pharmacokinetics, and we'll also look at some terms that are used in pharmacology. So stay tuned, subscribe to the channel so you will be notified whenever a new video has been uploaded. Thank you very much. Remember to share. Once again, subscribe so you don't miss out, and subscription is free.